begin our formal proceedings of this International Children's Health Conference with the name of Almighty Allah. I request Sara Bashir of Hamdard Village School, Karachi, to recite a few verses from the Holy Quran, which will be followed by their translation.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم ألم نشرح لك صدرك ووضعنا عنك وزرك الذي أنقض ظهرك ورفعنا لك ذكرك فإن العسر يسرا إن مع العسر يسرا فإذا فرغت فانصب وإلى रब्बिक फरगब। तर्जुमा। शुरू करता हूँ अल्लाह के नाम से जो बड़ा मेहरबान और निहायत रहम करने वाला है। क्या हमने तुम्हारा सीना कुशादा ना किया और तुम पर से तुम्हारा वो बोझ उतार लिया जिसने तुम्हारी पीठ तोड़ दी और तुम्हारा जिक्र तुम्हारे लिए बुलंद कर दिया। तो बेशक हर दुश्वारी के साथ आसानी है जब नमाज से फारिग हो तो दुआ में मेहनत करो और अपने रब ही की तरफ रग़बत करो। Translation. Did we not expand for you, O Muhammad, your chest, and we removed from you your burden, which had weighed upon your back, and raised high for you your repute? For indeed, with hardship will be ease. So, when you have finished your duties, then stand up for worship, and to your Lord direct your longing.
I heartily welcome you all to the 32nd International Children's Health Conference 2024. Now, I would like to welcome all our honorable guests who are online with us today. Mrs. Sadia Rashid, President Hamdard Foundation Pakistan, President of the conference, Dr. Luo Dapeng, WHO Representative for Pakistan, Chief Guest, Professor Dr. Raza-ur-Rehman, Dean, Faculty of Health and Medical Science, Hamdard University, Guest of Honor, Dr. Sara Salman Zuberi, Head WHO Sub-Office Sindh, and vote of thanks from Dr. Khalid Naseem, Administrator, Hamdard Public School, Karachi. Distinguished guests and beloved students, we gather here today to commemorate World Health Day. It was the 7th of April, 1948, that an organization was established under the auspices of the United Nations and was named the World Health Organization, WHO. Since its inception, WHO is committed to not only ensuring that everyone everywhere can understand their right of good health, but also ensure the provision of good health to the highest level for all. This year, the World Health Day has focused on the theme, My Health, My Right. My Health, My Right is a fundamental concept that sums up the idea that every individual has the right to know, access, and maintain their health and well-being. Health is not merely a privilege, but a fundamental human right. Various international declarations and treaties recognize the right of every individual to the highest attainable standard of physical and mental health. Today, we have students from all over Pakistan and international community to discuss the value of health. Health is an asset to human life, which leads to a stable and calm mind for a purposeful and a happy life. That's why it's important to be proactive about one's health and take precautionary steps to prevent illnesses and diseases. A visionary leader, ensures the vision becomes reality by stating clear goals, outlining a strategic plan for achieving those goals, and not only equipping but also empowering each member to take action on the plan at the organizational, team, and individual levels. Dear participants, I invite President Hamdard Foundation Pakistan, Mrs. Sadia Rashid, for greetings and opening remarks.
WHO representative for Pakistan, Chief Guest Professor Dr. Raza-ur-Rehman, Dean Faculty of Health and Medical Sciences, Hamdard University, Guest of Honor Dr. Sara Salman Zuberi, Head WHO Sub-Office Sindh, Dr. Badr Munir, WHO Sub-Office Sindh, national and international delegates, Assalamu alaikum. I welcome you all to the 32nd Hamdard International Children's Conference. My heartfelt greetings to each one of you on this momentous occasion. Thank you, Dr. Luo Dapeng, for joining us from Islamabad. We are truly honored by your presence and your participation. The Hamdard International Children's Health Conference, initiated by the visionary Hakim Mohammed Said, served as a beacon of hope, uniting us in our commitment to promoting healthy living and ensuring every child's right to health. In line with the vision and mission of its founder, Hamdard Pakistan has been addressing critical health issues since its inception through seminars, symposia, workshops, and conferences. Today's conference is a testament to our continuing endeavors in the direction. Dear participants, access to quality healthcare and essential health services is a fundamental human right that everyone deserves to enjoy. This year's World Health theme, My Health, My Right, emphasizes that each individual has the right to prioritize her own health and access quality healthcare services without discrimination. We must face the reality that diseases, disasters, and climate crises continue to threaten lives worldwide. During the global pandemic, we witnessed the escalation of health crises, serving as an alarm for safeguarding public health. Even amidst these challenges, it is important to uphold the principle of my health, my right. Everyone deserves to have control over their own health, their healthcare decisions, including information about their diseases and treatments. Health is not just a privilege, but a basic human right, and we must ensure that everyone has access to the healthcare they need. We often hear the proverb, health is wealth. Dear participants, let's pause for a moment and reflect on its meaning. It is important to recognize that good health is the foundation for building not only individual lives, but also communities and economies. The value of health extends beyond the individual level to a global scale. While the people of privileged nations have access to advanced healthcare systems, many underprivileged countries are deprived from even the basic healthcare facilities. Unfortunately, in many regions worldwide, the basic human right to health remains elusive due to barriers such as poverty, discrimination, and inadequate healthcare infrastructure. This is a grave injustice that demands collective action to drive societal change. But before we can transform society, we must first transform ourselves. In today's Pakistan, we bear the responsibility of ensuring that every individual first recognizes and then exercises her right to health. This involves advocating for health equity, promoting health education and awareness, and addressing the health needs of the population. Our efforts in this regard must never stop. While there's still much to be done to improve the healthcare system throughout the country, it is encouraging to see that the government of Pakistan is taking initiatives to transform healthcare infrastructure and ensure affordable healthcare for its citizens. We are already in the second quarter of the year, and the time is flying as fast as you can imagine. It's essential to consider how our actions impact others as well as reflect on our work. You might wonder how. By prioritizing basic human rights, such as ensuring access to clean water and in contributing to environmental conservation efforts, such as planting more trees, which are essential for leading a healthy lifestyle. On behalf of Hamdard Foundation Pakistan, I once again offer my sincere thanks to Mr. Luo Dapeng and to our chief guest, Professor Dr. Raza-ur-Rehman, Dean Faculty of Health and Medical Sciences, Hamdard University, guest of honor, Dr. Sara Salman, and who will be joining us from Cairo, and Mr. Badr Munir, representative of WHO Regional Office, Sindh. I appreciate the foreign delegates and participants who have joined us from across the globe for this conference, and wish you all a fulfilling and rewarding participation in the conference, and congratulate the organizing team for its hard work in making this conference a reality. I am sure that the recommendations and thought-provoking ideas from our young speakers will pave new ways and open up new chapters deserving adoption in the global healthcare system. The future is now in your hands. Thank you very much, everyone.
Thank you, madam, for your thought-provoking speech. Dear participants, last year, the World Health Day's theme was Health for All. Hamdard Foundation Pakistan took the initiative to organize multiple programs on the 75th anniversary of WHO. Different programs were conducted under the banner of Hamdard Foundation Pakistan and Hamdard Public School, such as art and poster competitions in which many schools participated. Free medical camps were conducted. Health Walk was organized on the 10th of March to highlight the importance of health. Speeches and opinions were shared in two different forums, such as Hamdard Noneha Assembly and Hamdard Thinkers Forum, Shura Hamdard. Sports and physical activities were conducted. Short videos and clips were shared through social media to spread awareness about physical and mental health. Hamdard Foundation Pakistan took a commendable step by distributing health cards, Hamdard Health Cards, HHC, on 20th of March for transgender individuals through two renowned hospitals where medical treatment and financial assistance were facilitated by Hamdard Foundation Pakistan. My Health, My Right empowers individuals to take charge of their own health and well-being. It emphasizes the importance of access to healthcare services, ability to make decisions, and take full charge of their own healthcare and healthy lifestyle. Now, our first speaker, Maheen Beg, is from the host school, Hamdard Public School, Karachi.
Respected President of the Conference, Honorable Chief Guest, President Hamdard Foundation Pakistan, Honorable teachers, and my fellow students, Assalamu alaikum. World Health Day is an opportunity to focus on key public health issues that affect the international community. Today I, Maheen Beg, have the honor of addressing you on a matter of utmost importance, the right to good health. It is with great conviction that I speak on the topic of my health, my right, as it is a fundamental principle that resonates with us all. Distinguished guests, the human right to good health means that everyone has the right to the highest attainable standard of physical and mental health, which includes access to all medical services, sanitation, adequate food, healthy working conditions, and a clean environment. Honorable guests, health is a basic human right and should be accessible to all people. I believe that health should be considered a fundamental human right because it provides quality of life, encourages equity, provides prevention and awareness, and eliminates discrimination among people. Dear guests, it's not just about avoiding sickness, it's about taking care of our bodies and minds as healthcare as a basic right. As it is rightly said, but sadly, the reality is that not all individuals have equal access to healthcare. Barriers such as financial constraints and adequate health infrastructure and discrimination prevent many from exercising their right to optimal health. As it is rightly said that take care of your body. It's the only place you have to live. Gandhi said, it is health that is real wealth, and not pieces of gold and silver. Esteemed guests, we must recognize that health is not just a privilege reserved for the fortunate few, but a basic human right that should be accessible to all. In order to achieve this, we need to advocate for policies that prioritize healthcare as a basic right. We must invest in healthcare system and increase funding for research and development. Dear listeners, however, the pursuit of health as a right is not solely the responsibility of policymakers. Each of us has a each of us has a role to play in promoting this cause. By taking charge of our own health, making informed decisions, and adopting healthy lifestyles, we can set an example for others. By raising awareness and advocating for change within our communities, we can contribute to a world where my health, my right is a reality for all. In the end, let us unite and strive to transform my health, my right from a mere concept into a tangible reality. In the symphony of life, let my health, my right be our empowering melody, harmonizing well-being as the fundamental key to a flourishing existence. Together, we can build a world where my health, my right is a reality for all, and where every individual has an access to the health care they deserve. Thank you very much, everyone.